All right, I'm just gonna wait to see who comes in before we run it. We're gonna see first how it's done. I guess we'll watch. See, this one says don't get a thread lift. This one is how long? 7 minutes. This one is 26 minutes. So first we'll see this one. Actually, let me see who's here right now. Oh, I don't have my screen showing. Sorry. Tell you in a minute. 0 viewers so far. All right. Well, we're going to watch it. Let me put my screen on. Okay. Screen share. There. Okay, you're seeing my screen now. Nobody came back? Oh, nobody wants to see it. All right, I'll wait a couple of more minutes. I'm going to watch it. Maybe people will view it later. I don't know. But what we want to do is, first I want to see how it's done, which looks like this one. And then I want to see one where, okay, this gentleman here says, he's a doctor. He says, don't do it. I've heard mixed reviews, so you have to decide for your own. And then I saw one where it said Facelift procedure gone wrong. Here, this is a doctor doing it. You can have it done at the esthetician as well. So they're putting like a barbed wire, look at that, like a barbed wire into your face. A barbed looks like it's plastic, but nobody wants to see it. I have no viewers right now. If someone there, it says 0 viewers, so I may just go ahead and maybe some of my viewers will want to see it later. What's going on over here? Oh, yes, I would love to go back, but with my current family. Yeah, I wrote about a poor lady. I wrote up a comment. All right. Oh, now look, it looks like Kylie Jenner might have. Ooh, what is that? Oh my goodness, I have a feeling I am not going to have that done. I don't know. Let's look anyway. Okay, no viewers. I don't blame you. How non-surgical thread lifts work with PDO threads. Okay. Okay, I'm getting ready. See, here's the one. The danger behind the latest fox eye. So first we're going to watch how it's done, and then we're going to see the danger. But I have no viewers, which means probably none of you wanted to see it. So, all right. Beauty, this says don't. Lower facelift. So apparently you can do it in the mid face and the lower face. This is a med spa. So see, an esthetician can do it and a doctor can do it. I guess I would trust a doctor more. But here in Florida, with proper training, an esthetician can also do it. I don't know, each state is different. So let's see how the esthetician does it. And then we'll see too about why not to do it. We have to have a balanced. Okay, I guess I'll go ahead. I don't see anyone in the chat, so I guess no one's interested, but in case anyone comes later. All right, here we go. Let me turn off the... Oh, first of all, let me go like this. I'm going to turn off the microphone, make sure it's off. Okay, and we're going to do it. See you in a bit.
I didn't choose this exact type of metastatic breast cancer, but I did pick clarity by knowing I have a treatment that goes right at it.
Discover Piqray, a treatment that specifically targets.
Hi, Aida. How are you? Good, how are you? Good. I have an appointment with Heather. Okay, perfect. I see it on the schedule. Come on back with me. Gonna be in here, and then Heather will be in shortly, okay? Thanks. All right, Heather. Miss Aida is here. Okay, perfect. Sounds good. I already looked her up in the system just to get all of her medical history and stuff out of the way. We really want to make sure you're cleared for all these procedures. I did have an Instagram consult with her last week where we discussed some of her concerns because she did come from far away. So we're just going to go in now and talk a little bit more with her and make sure she's a great candidate for this. Let's go see her. Hi, how are you?
Good, how are you?
I'm good. It's nice to meet you in person finally.
to meet you.
Alrighty, so, you know, we talked a little bit last week about maybe doing some threads.
Yes.
Why don't you just tell me real quick what it is that's kind of bothering you?
These lines.
Okay.
And sagging skin and underwear.
Kind of in that jowl area? just want to kind of have everything pulled up a little bit. Okay. Well, when we look at lines kind of in this area, we really want to make sure that we're treating the cause of those lines and not treating the lines themselves. So for you, I do see a lot of this tissue has kind of come down this way over the years. I really feel like lifting this back up will kind of bring life back to that, and the threads also give you really nice contour to the face. That will also give you that nice little cheekbone, that nice chiseled jawline. So I think doing the upper and lower would be really nice for you. I think we may still need to go in and just do a little bit of like airbrush filler after it settles, and maybe even some smooth threads through here, just to kind of give you some of that texture and volume control there without actually adding a gel filler, which could make you look a little bit wide. Right. But good skin texture, skin quality so far, nice and not too thin, not too thick, so I think you'll handle the threads really well. Any questions about the procedure itself?
No, I've seen so many videos, I'm okay.
Okay, perfect. So I just want you to make sure, no dentist or anything like that, or opening your mouth super wide for like the next month or so. 2 weeks for sure, because we don't want to break those threads or displace them. And then a couple weeks after that, you'll just a little bit careful, but you can get back to your normal self. But visually, there's really not a whole lot of downtime. Usually no bruising with this, just a little bit of inflammation, but I'll give you some steroids to go home with.
Okay.
Okay.
Chewing gum and stuff like that, is it okay?
I would probably lay off that for a week or two. You'll be a little bit tender, but after that, you're fine.
Okay.
And then we'll bring you back for a 2-week follow-up. If there's any puckering or anything, we'll massage that out. And then most results are seen between 3 and 6 months.
Okay.
So it's a little bit of a waiting game, but it's totally worth it.
Okay.
All right?
Alright.
So I'm gonna go get set up, and then I'll be back in and we'll get started.
Okay, sounds good. Thank you.
You're welcome. So we will wait for Giovanna to get back, and I'll have her go in and take some photos. I'm gonna start setting up my tray, and then you get to watch the fun stuff.
Hello, how are you? How are you? Great. My name is Giovanna. I'm the medical assistant. I'm just going to grab some photos before your treatment. So that way, once we're all done, we'll go ahead and capture your afters and be able to show you. Okay? So I'm going to have you come on right over here, and I'll have you stand on each number 1 facing that wall for me. Perfect. And then go ahead and put your hair behind your ears. Beautiful. Look straight ahead for me. With your chin, I'll have you turn the slightest bit towards me. Awesome. And a little bit more. And then 1 foot on each number 2. We're going to go counterclockwise. Go ahead and have a seat. And I'll have you put on this cute little headband. It's not that cute, but that way your hair is out of the way. No way of getting an infection, anything like that. Just like a headband, go ahead and put it on. And then at the same time, I'll go ahead and sit you up. We'll come on back in and get started. Okay, thank you. You got it.
So I'm gonna go ahead and get her tray all set up for the threads. We use the Mint PO threads, quite heavily packaged. I don't know if you guys can see all those nice little barbs on there. That's what's gonna pull up her tissue. So I'm just gonna get all that set up on the tray. Takes quite a while to set up, and then we'll go in and we'll get treating. Got the tray all set up, well, let's go in and get started. Alrighty, all set? Okay.
I put a little bit of makeup on. I had to go to the office today, so
Yep,
I'm sorry.
I'll wipe it off. You're fine. Do you want a stress ball to hang on to during this?
Is it gonna hurt?
There's just some pressure. And
that's fine.
some people just like it just for the comfort.
No, I'm alright.
I'm just gonna get a headband on to kind of protect and keep all the hair out of the way. And I usually use a soaked gauze with some cleaner on it just to kind of hold everything back out of the way. I'm gonna clean everything. I'm gonna start my first palette hole kind of around here. I'll draw some lines and then we numb the palette holes, but that's really all the numbing that you need for this. Okay, so I'm gonna have you go and set up for me real quick. And then turn for me a little bit. I'm gonna draw on her. This is gonna kind of tell me where I wanna do my vectors, so how I wanna pull the tissue. Sometimes I change how many threads I use in each side. Usually I start start or plan to do equal unless something looks really uneven. But then after I put the threads in, I always evaluate, and that can always change. This patient, we're planning on doing the same amount both sides. What is it now? About 5 to 6. Okay, you can lay back. I'm going to numb the pilot hole for up here first. Just a tiny little poke. So this is just an injection numbing. It kicks in pretty quickly, just to give some comfort from the little poke we're gonna do with the needle for the pilot hole. And then I will make my pilot and the needle. And this is the only sharp thing that we use, otherwise we use a blunt tipped cannula. Can you feel a little pinch? 1, 2, and 3. And then as you can see, the cannula is blunt tipped. So this is just gonna kind of push all the tissue out of the way, and then the thread goes inside of here.
Time. It's life's most precious commodity, especially when you have metastatic breast cancer. When you're
Most patients don't feel a whole lot of pain with this, just pressure. And then at certain points when we're crossing over where there might be a nerve or something, maybe there'll be a little bit more of a pinch. Okay, so the cannula's in for the first thread. Take this part out. And then take my thread. And then we pull again out. I'm just keeping the thread in so that it can grip. And then we pull the cannula out, and there is the first thread. How was that, Ida?
Wasn't too bad.
What would you say?
It was just
0 to
pressure.
10.
0 being the least.
Least pain, yeah.
Maybe 1 or 1.5.
Perfect.
Yeah, it wasn't too bad. Just pressure. A little tightness, I think.
Okay. Then we just move on to the next.
Oof. Oh, sorry guys. I want to see the date of this video. That is a little more invasive than I expected. But okay, it was from, well, close to 2 years ago. But I'm sure the procedure's more or less the same today. But we might skip through. I don't know. But that part already is a little scary for me. I don't know. Now, that might be a doctor, and maybe at the esthetician it's less invasive. I don't know. Because mine was, or I don't know if I'm going to do it. Supposedly it's going to be done by my esthetician who's getting training. You get some nursing training to do this. Make sure it's a certified person, of course. But I don't know. I didn't realize it was that invasive. So I may not do it. We'll see. And we're going to see the cases where it's gone wrong, because we got to know both sides of it. Okay. I'll get back to it.
We really go kind of by feel. We want to make sure it's nice and even. We don't want it too superficial. We don't want it too deep. Nice thing I like about these type of cannulas is that if I do get into the wrong plane, I'm able to back up and redirect. Whereas with the pre-threaded cannulas, once you're in, you're in. So that can get you in danger zones. These threads are also a little bit longer than the pre-cannulated ones, so it gives us a little bit more wiggle room for more lifting power. Nice check after each one to make sure we don't see any puckering. Make sure it's pulling up nice. And we're going to do one more on this side. It looks kind of scary, but it's really, as Ida told you, it's really not bad. I'm just going to a little bit more of a pull. Okay. Yeah, some areas are harder to get through than others. And then sometimes you feel a little bit more pressure. That could be just different connective tissues.
Have you ever had anyone change their mind and take it out?
Mm-mm. Now that easily just slid through. Mm-hmm. So first I got the threads out of the way, and then we kind of redirected into the right plane. And then it's a much smoother transition. So see here, a little bit of a pucker. Sometimes you can work that out. And then anything that's usually left over usually settles within the 2 weeks, and then we can massage it out at the follow-up if it's still there. Massage. This part tends to be a little more sensitive. I guess I shouldn't really call it massage. It's not massage. It's It's basically just getting all of the skin engaged onto those little barbs.
Clicking.
Okay, so now we're going to move on to the jawline area. And we'll book 1, 2, and 3. These threads have kind of multiple benefits. These are barbed threads. So like I showed you at the beginning, they have little kind of barbs on the ends of them. And what this is for, it actually kind of grabs the tissue so that the tissue can be kind of almost snapped onto those barbs, and it will kind of reapproximate and pull it up. Versus smooth threads, which we might do for her later here, which are just a completely smooth thread like the ends of these that strictly stimulate collagen. But in any case, this is going to give that lifting capacity, and it's also going to stimulate her collagen. So it's going to help her skin tone and texture in the area. It's going to help lift everything, tighten everything, and just kind of provide a longer term benefit than using fillers alone. But you have to be patient because it does take a while for collagen stimulation to happen. It's a good 3 months before you see a whole lot. As well as our profound machine that we have is it's a really great alternative to surgery. So this is really great for people who kind of want that little mini, almost like a mini lift without having to go under the knife and take, all the risks of having a major surgery. This isn't going to get you quite the results of a full-on facelift, but for it being a non-surgical procedure, it's great. We're going to massage again. That's the worst part of the procedure. Wait until I do the other side before I tie them all off, but when we tie them off, we'll also pull them a little tighter, and that's what's really going to give her that lift. We want to make sure that everything is nice and even first before we secure them. I'm going to show you guys. I'm going to turn. So I've got one side treated, one side not. We can take these threads. This is what I love to do. And you can see the pull. So when we actually tie these off, you'll actually pull them to kind of keep that lift. So that's pretty cool. I'm going to numb this side. Again, just at that little pilot hole. Heal nicely. Check and make sure everything looks nice and even. Got a little bit of a pucker going on right here. There we go. And then any puckering that's left, I always tell people just leave it alone, let it do its thing. Most of the time it works itself on its own. If not, that's what the 2-week follow-up is for, and we will take care of it then. So now we're going to work on tying these off so you can see the final result. Nicely, and we just put a little cover over this. Sometimes these little pilot holes can get infected, but usually as long as you're, keeping them clean, you keep the bandage on, totally fine.
When do I keep the bandage on?
Just until it falls off. It's like a little sticky, like a sticky band-aid, and it stays on usually for like a day or two, and then it kind of falls off. Just help cover and protect the hole, the little pilot hole that we made, because it is a little bit of a larger hole, just so that we don't get any bacteria in there, that we don't cause any type of infection. It just protects it. Just a little steri strip, usually falls off within 24 to 48 hours. There's really nothing else you have to do for this. Sound getting this procedure done. Can you hear a lot of it? Like the clicks and
the clicks, yeah. Nothing more than that.
used to use a lot of threads, like more thicker, non-dissolvable threads or more surgical type threads. But they've really kind of expanded the market with coming out with these more non-surgical dissolving threads that are a little bit safer, a little bit easier to manipulate, and just a little bit better. Stitch it up. Things to look out for, the little pilot holes. If you see any like tufts or drainage, extreme redness, hotness, anything like that, give me a call. Usually it's just like a little hair got stuck in there or just a little like infection started. Usually we just start you on a low dose antibiotic and all is fine, but I need to know right away. You're going to be tender, okay, so that's why I recommend not really sleeping on your side. Number one, not to hoist the threads, but also so that you're not creating excess tenderness for yourself. Tylenol for any pain. You can also do ibuprofen if you're worried about a lot of the swelling, just because bruising is usually not an issue with this. I'm going to give you 10 milligrams of a steroid now and 10 milligrams to take home. I'd probably wait till the morning since it's so much later in the day right now, and that will help with some of that initial inflammation. That should go down. Anything done. So there's a couple of areas. We have a little bit more swelling, kind of right in here, and then we got a nice little swelling starting here. Don't worry about that stuff. That will all come down, and I'll see you back in 2 weeks, and we will make.
It seems to me, I don't know, but it seems to me that this is a doctor. I turned on the air conditioning. I'm sorry if there's too much noise. Because the procedure can be done by a doctor or an esthetician who has some nursing training. But she sounds like she's a doctor, so I'd like to see it done at an esthetician to see if it's done differently or, something. But anyway, we'll figure that out later.
Make sure everything is healing as expected.
Okay. Oh, okay.
Any questions right off the bat?
No, not at the moment.
Okay. Yeah. Again, probably
I'm a
don't.
bit smarter, but
I know it's like hard to. Probably don't see a whole lot now. A lot of people get kind of like, whoa, I don't see a whole lot. Don't get nervous yet. Like I said, the real big part of this is that collagen building, and that takes time. So even at 2 weeks, you probably won't see a whole lot of change.
Oh, hi, Becky. Yeah, I just read your chat. I hadn't been reading it. So, yeah, I know that the esthetician that has told me about it, that I'm considering doing it, because I trust this esthetician. I've been going to her for a few years. She's getting the training now, and it is some nursing training. She's not going to become a nurse, like a full nurse, but apparently this has to have some nursing. But so you said your nurse didn't want to do it, the nurse you went to. So, yeah, I don't know. You got the fillers, okay, on the marionette. Oh, so did I. I got the hyaluronic acid. I don't know. I had a little done, I guess, by a doctor in Argentina. That's why I could get it cheaper down there. But this doctor is well known in the city I was. I don't notice much difference, though, but I guess because he did just enough for it to be... I think I look a little more refreshed, maybe. So, but the result, it was too expensive to maintain. Yeah, I mean, if you ever travel to Argentina, you can get it done there for way cheaper. And the doctors are good. 1 second, that's my father. 1 second, I'll be right back. Okay, thanks for your patience. So we'll get going on this. Yeah, so, yeah, I'll tell you about, I had it done in Cordoba. I had Botox and I didn't know they were called marionette lines. And I had my lips a little filled. You'll see me in a minute if you're just coming in now. I look pretty much the same. I don't notice much difference, to be honest. But he didn't want to overdo it and make me look silly, because if you overdo it, it looks kind of silly. But I wanted it to be noticeable, but my lips I notice a little bit, but I don't notice much else. Anyway, we'll see if she's a doctor or maybe she's a nurse, but I'd like to see just a plain esthetician do it. But before that, I'm going to see the downside, the people who've had it done wrong. Because that was scary. I saw a picture a minute ago. Okay, we'll continue.
But at that 3-month mark, that's like that golden sweet spot. So I'll finish. If you want to go in and get her after photos, here's her water. Tylenol now, 1 extra strength, 1 steroid now, and then she can take the other one home to take tomorrow morning. I already went over it with her, but she can tell her.
Yay, awesome. Thank you. Let's go stick her. How'd it go? Good. Here is your Tylenol and then the prednisone. Then we're just gonna take some last photos.
You want it the way you want it.
Are you understanding what I'm saying to you?
You're not going to get every single thing that you want. It's not the end of the world.
This is how you start the party. Want this face to believe that? I just want to be free.
Los Latinos, we don't hustle to leave our community. We hustle to make an impact on it.
You're all set. So here are your aftercare instructions. If you have any questions on any of this, feel free to text us, call us. We're literally on our phones all the time. So you are set to go.
All right, beauty boosters. So that is the mid-face and lower face thread lift. We just finished up. This is how she looks leaving the clinic. Really not too bad. Just a little bit of inflammation. And we are going to see her back in 2 weeks. Make sure everything is healing as it should. And that's when those threads are really okay.
Yes.
Okay. Any significant pain anywhere?
Right here on my lip. The first week I thought maybe I got a sore or got a cut.
Okay.
And kept putting like lip balm on it, and then I realized, wait a minute, something's actually.
Is it all the time or only like when you smile or something?
It wasn't all the time. It would just hit me once in a while like a bolt.
Okay.
Mm-hmm. But today it's just been really painful. Like I couldn't eat, I couldn't speak. It's just been kind of like, I don't know if it's swollen or if it just kind of looks like it's just right here on my lip.
Yeah, so at the 2-week mark, the threads are still pretty fresh in there. Like I said, you can still feel that they're kind of catching on stuff. So sometimes if the thread is kind of overlapping a little bit with a little nerve or something, it can still create a little bit of irritation. Also because you still have a little bit of swelling going on, that can also cause a lot of things to feel tight and different. So I wouldn't worry about it too much. If we're still kind of feeling that at like a month or a month and a half, then we'll kind of take a better look. But usually even with threads, if they do kind of disrupt a nerve a little bit, it can last a little bit, but it usually does resolve.
Okay.
So I'm not too worried about it. I don't see like any threads poking out here or anything, or I don't see any like drooping of your lip or anything. So it's probably just a thread that's kind of just every now and then with certain movements is catching a little bit on a little piece of tissue, which is irritating a nerve in that area.
Okay. Yeah, I was just wondering, like, do they move or is it?
They can. So that's why it's so important that you are so careful with your post-care, so that we don't break the threads and that we don't disrupt the threads in terms of disengaging the tissue off of those barbs, because then you kind of can lose your lift. We'll take pictures today so we can kind of see your results compared to when we first did it, but remember, the majority of the results we won't see until about 3 months to 6 months. Okay. Because even though we kind of see a little bit of that lift right now, we haven't seen a lot of that collagen stimulation. I just want to check. Go ahead and give me a smile. Relax. One more time. And relax. And then open the mouth. Okay, good. So I'm looking just to make sure we don't have any puckering or anything. It's just a numbing. Just your nerves playing tricks with you. Okay, let's take your photos and then I can put them together with your originals so we can kind of see your before and after. Have a seat. Perfect. Let me go put those together quick so we can look at them before you go, and then I'll be back in. Do you have any other questions before I do that?
No. This was my main concern. That still, hurts, but that's.
So I'll check in with you via text another 2 weeks to ask about that. Otherwise, if then it goes away, then the next step will be to see you at 3 months. All right, we'll be right back. So let's look at our before and afters. Alrighty, I just finished up making her before and after, so we're gonna go in and we're gonna show her, and she's gonna be really excited. Let's go. So I just put them together for you. So remember, we're only at 2 weeks, but already for 2 weeks, I'm very happy with what I'm seeing so far, so I cannot wait to see at 3 months. So here's your frontal photo.
Okay.
So what I love most about threads is even like just your skin texture and skin tone is better because it started that collagen process. You can see those lines are not as deep. That's a really good sign already for 2 weeks. And then I did your oblique angles. So I really like, especially on this side, you can see that improvement in that jowl area. Really lifted that. Very, very good for 2 weeks. Some people I don't see a whole lot at 2 weeks. We're just gonna keep letting it do its thing. Keep being careful for 2 weeks so we don't disrupt any of those threads. And then I'll see you back at the 3-month mark.
Okay.
Okay? But I'll text you in like 2 weeks to ask about this guy.
I noticed my skin's got a little more oilier than usual. Is that part of it? Is it?
Not from what I've heard. The only thing that I could think is just that now that you're really increasing your collagen in that area and just improving your skin in general, it might just be regulating your oil production better so that you're not so dry. I haven't specifically heard that like threads can do that, but that is the only kind of thing that I can think of in my mind.
I was thinking maybe since I can't really touch my face and put moisturizer on it, just like it produces even more oil.
It could also be, something due to those types of things. It could just be part of, your skin kind of freaking out a bit with the healing process. But if anything, maybe if you do feel oily, I think you look really great oily then because I think it's really made your skin look beautiful. Any other questions?
No.
Okay. I'll walk you up to the front. We'll have Dakota book you for your 3-month and I'll text you in 2 weeks.
Okay.
Thank you for joining me for that.
I'm gonna turn off the air conditioning 1 second. Okay, so, I skipped through it. If you want to watch the whole thing, I guess you can. That is the name of the channel. I'll put the channel in here in case you want to see the whole thing. 1 second, where's my glasses? I took them off okay, here we go. I got that thing. Hang on, I'll show you my face. To those of you who are just new here. What is that? Okay. Here's the studio. There. Okay, that's me. Well, those of you who don't know me, this is my face now. I have no lips ordinarily, so I got lip injections, which, wait a minute. Oh, this is backwards. Hold on. This is going backwards for me. I want to flip it around. Oh, wait. Okay. Hang on. I got to see how I look here. What's going on? I'm over here. Hang on. My channel. I want to see what you guys are seeing. So let me go here. Where am I? How come it won't open? Here? Okay, there we go. All right. That's me. So I gotta flip it. It's going backwards for me. Okay. I'm 55. So, I guess I look about 55 with a facelift. But no, I kind of do see, I have Botox up here, so you can see my forehead is frozen. I can't move it. And basically Botox just makes your face freeze. That's why I didn't put it here, because I don't want to be stiff. So you can't make expressions when you talk, because I'm very expressive. I move my whole forehead. See here, this though, I thought he was going to freeze this part, and he didn't. So I'm going back to Argentina anyway, because I have to go. I'm going to stop by and ask him if he would freeze this part. I can, have a free follow-up if I'm not happy. He may have not done it on purpose because he thinks I would be too frozen, but you see the lines I have in the middle is because I'm always doing this. So that was one of the things I wanted frozen. So I'll go back and get that done. And then I had the filler here, hyaluronic acid, and I had my lips filled with hyaluronic acid. Which, imagine, if these are my lips filled, which I barely noticed, to be honest. I might get a little more, but all right, so now we're gonna see what went wrong. Can we hear me though? Acid. Hello? You can hear me. Okay. Is that loud enough? Oh, I put it low because I didn't want you to hear the fan, so I put the microphone low. I put it a little higher now. Let me see. I just want to hear myself. All right, so now we're gonna see what. All right, you can still hear me. All right, let me go back to the screen. I just learned how to do this with the OBS Studio, so I'm still a little bit... There we go. I think you can see my screen. Let me double check. Should be in a minute. There's the delay. I'm going cross-eyed. I go cross-eyed when I'm wearing my contact lenses. Did we switch yet? How come? Okay, there we go. All right. So now we're going to see how these went wrong. How some went wrong. Now the first one was this. See, we're going to watch him too. Don't get a thread lift. He's a doctor. Oh, that's a little scary though. I don't know. It's non-invasive, but it's a little too invasive for me. Okay, let's see what happened to this poor man.
Yo, what up? It's 2 Chainz. And this is Butter, baby.
Panera chefs have crafted a masterpiece. Succulent seared chicken, a secret aioli, clean ingredients, in a buttery brioche roll made fresh to leave you speechless. Panera's new Chef's Chicken Sandwiches, $1 delivery fee on our app.
The latest non-surgical tweakment being widely advertised on social media. It's known as the Fox Eye Facelift.
Well, inspired by the likes of supermodels Bella Hadid and Kendall Jenner, the procedure involves inserting plastic threads at the side of your eyes in order to stretch the skin and create a new look. Those models haven't had that done. It's just that they have that sort of naturally, and that's what people want. Many medical professionals have called the procedure irresponsible and dangerous.
Well, our next guest, Ryan Rutledge, underwent a Fox Eye facelift last year but was left hospitalised following complications. He joins us now alongside facial aesthetic specialist Dr. Pamela Benito. Welcome both of you.
Morning. Morning, welcome.
So this is promoted widely on social media.
The only good thing, I guess, apparently it's reversible. Well, he probably had to spend some money, though, to get it fixed, but he looks okay now. So those threads are dissoluble, or they dissolve over time, supposedly. We got to find out about that. But, okay. Even so, that procedure looked kind of scary for my taste. I don't know if I'm going to do it now. But anyway, let's see what he has to say.
Media. Ryan, you are a social media influencer. You're an aesthetic practitioner.
Yeah, I do aesthetics.
Yourself,
yeah, I do.
But that's providing Botox fillers, for someone who.
Oh, hi, Becky. I hadn't been reading the comments again. Thank you. So maybe you notice a teeny bit. Yeah, right. I think I look a little bit more refreshed without looking like I had a surgery or anything done. That's what I'm going for. But sometimes you lose perception, and then that's why you see people out there who start to look silly. They start to look kind of ridiculous because they don't realize themselves. Because I'm on video a lot, I guess I would notice. I'm starting to think today I look a little better than I have been for the past few weeks. Maybe it took some time to settle in, but yeah, I'm not sure about that thread lift though. We'll see. I'm going to double think it now. I'm going to rethink it. Okay, back to the show.
Extensively knows about this field. And what made you decide you wanted to do this?
I'll be completely honest with you. Somebody messaged me and just said, I'll give you it for free if you promote it on social media. And I just took it. And I feel a right idiot.
Oh, well,
so this is...
Listen, you're not alone.
I'll hold my hands up. I'm not here for sympathy. I'm just here to warn people,
Don't do it.
Did you do research?
Not really, no. She just messaged me and said, I'll give you a £500 free treatment. And I said, yeah, I'll have it.
Okay, so you'd seen this Fox Eye look because you see it on social media. It is sort of the new trend. It is that sort of ideal look that people want, but obviously at quite a cost to you. So you get this message on social media and you go to the clinic and you have it done. What was the experience like when you had it done? Was it painful?
No, because they numbed it with injections, lidocaine, I think. So it weren't actually too bad, but I mean, it was quite vigorous. She was like pulling my face
So
up.
what, they insert a thread?
She put a thread in my eyebrow there, but I also had cheek threads done as well. So she put a thread from there to the top of my head there and started like pulling my face up and stuff, because obviously I wanted a more lifted look.
So this is what we can see.
Oh my God, imagine me trying to pull a fella looking like that. Like, that is horrific. Do you know
So this is you ended up with these really bizarre
pads, like
folds in your forehead there.
I look like an avatar.
So although it didn't hurt that much. She said she was a bit rough.
No.
It was done in 20 minutes.
It hurt after.
Yeah. When did it start to go wrong?
6 a.m. in the morning when I woke up, and I was like, oh my God, I've been hit by a bus.
Yeah.
It was horrific. And then it was probably well, it started getting swollen after a couple of days, but I thought that's probably normal. And then the infection started about 2 weeks after.
So, I mean, I did wince when I read this morning because the infection was severe. I mean, there was
pus coming out of it, my face swelled up, I was on drips, antibiotics, nothing was getting rid of it.
Was there any aftercare treatment from the clinic?
I don't really want to speak about the clinic or anything like that. I'm just warning people about that. I don't want to obviously...
But as part of that package, because I think that is quite important, as part of that package...
I don't feel like I was supported in the aftercare, no.
Right, okay. No. And as much as we're sort of, you are joking along with this, but actually this was really serious. And at one point they worried if it was going to be sepsis. And we know from speaking to people how deadly actually something like sepsis and... These procedures can be incredibly dangerous.
Honestly, it really affected my mental health, because obviously on the photos, what you've seen there, my face was all swollen. I didn't want to go out. When I did go out, people were staring at my face, looking at me as if I was some sort of freak. Like, it really did affect me mentally. Like, I didn't want to leave the house, and now I'm going to have to get corrective surgery because that eyelid is more droopy and I feel I just look really old and haggard.
Well, you really don't, for a start. You don't look old or haggard at all. How did they rectify it then? Did they have to
They didn't rectify it. I just had to go to the hospital myself. So I went to my doctors, had antibiotics. That didn't get rid of it. Then I had saline flushes, I had steroids, and then I ended up in hospital on an antibiotic drip. My body was actually reacting to the thread, what was in my eye. It was meant to dissolve after a couple of months and heal with this lifted look. But because my eye was rejecting it, they weren't healing. All the pus was just coming out, and I just had to deal with it in my own hands.
So, thankfully, it was conventional medicine and trained medical professionals that sorted you out. You say you put impressionable followers at risk. You promoted this on your socials.
This is why I'm on here to speak about it, because I feel so guilty that I've obviously gone onto social media. I've been given this freebie thinking, oh yeah, I'm getting a £500 treatment for free. I'll just put a few tags on Instagram. And obviously I didn't think nothing of it. But obviously if it hadn't have gone wrong, I probably wouldn't have thought twice about it. But because it has, I'm now thinking, I've got a younger sister that's 16. If she was older and she was to have seen that and been naive and got it done.
It's a horrible thought. Well, let's speak to Dr. Pamela now, because you're a leading facial aesthetic practitioner for over 10 years. And this is a popular procedure. Obviously, this experience was not a very good experience. Can it be safe, or is this just incredibly dangerous?
Yes, no, it can be safe. And obviously, I always recommend patients to do their research so they can find the right practitioner who is experienced enough and use the right products, mainly because of quality and safety. But it can be done safely, yes.
And you've brought the threads in here?
We did, yes, just to show you.
Can we have a look?
So it isn't actually that dangerous?
No.
Well, I pulled the short straw there,
no,
didn't I?
Of course, and
I think
it's just unfortunate,
the message, isn't it?
Yeah, that it's gone wrong, and I think with any medical procedure there is always potential risks and complications, and you should be aware of the potential risks.
This is unregulated. So you say, have this done by someone who is medically trained.
Absolutely.
I mean, you can essentially, at the moment, you can almost have this done in a garage.
Sadly. Yeah, so still in the UK, dermal fillers, a lot of procedures are still unregulated. Hopefully, it's starting to get in the right path to get everything regulated. But I believe that, obviously...
Oh, are you in the USA, Becky? I'm in the USA, in Florida. And in Florida, you have to get some nursing training. But even so, I'm not sure. And my esthetician is getting the training, and I trust her and everything, but I'm not sure, because I'll be one of her first patients. So I don't know. I trust her a lot, and I know, she's very professional in all the other treatments she's given me, but I don't know. I got to see it done at the esthetician. Maybe it's less. Maybe it's a little thinner wires or something, but we'll see. we'll see. I don't know what I'm going to do now. Before I was like, oh, it sounded very simple. Like the guy said, oh, it's just some kind of little thing. But now that I've seen it, I'm a little bit worried. So you're in the U.S.? That's where I am. Oh, I'll keep watching. You can answer if you want to. If you don't want to, that's fine too. Okay.
The practitioner should be giving him the consent and the aftercare beforehand, so he can make the right decision before going ahead with.
Testing, testing. It says the stream is unavailable. Let me just quick check if you guys are still there. Put in the chat if you're still there. What happened to my phone? Is it my phone or is it... Shoot, my phone turned off. I must have run out of batteries. Let me see. Maybe I'll see it over here on YouTube. Oh. No, it stopped. Oh. Okay, let's have a quick look